I'm actually relatively new to the work of gun violence prevention. I didn't come from a family that owned guns, and really besides seeing school shootings on the news or community violence on the news, that I didn't have much of a personal history with gun violence either. On the pediatric side, in my training, I thought I did a pretty good job about screening for guns in the home and talking to patients about that. But I didn't always have a good response where if a patient said, well, if a parent said, well, yes, we do have guns in the home. I didn't really know how to continue that conversation or what more counseling to provide. And then I'll be honest, on the adult side, I never asked any of my adult patients if they had guns in the home, or I didn't provide any counseling on that at all. So that was sort of where I was until last summer. After the Uvalde shooting, I got an email from Dr. Welton because he had been looped in with some folks from the Brady Campaign. That's a national nonprofit organization for gun violence prevention, as well as the folks at Children's National and the trauma surgery team at GW to work on creating a curriculum for residents of across any medical specialty. So pediatrics, obviously internal medicine, surgery, but even, OB/GYN, emergency medicine, pretty much everybody, to figure out how we can sort of help residents learn how to counsel their patients on gun violence in a non-stigmatizing, non-judgmental way. I wanted to go into my goals and objectives. My goal for this talk is not to make everyone in this room an expert on firearm safety or gun violence prevention. My goal is also not to just add to your laundry list of counseling things that you need to talk to your patients about. I already know that is extensive and lengthy as it is. But what I want to do is introduce some quick tips, some helpful phrases on how you can introduce this topic with your patients in the clinical setting. I want to teach you some very basic ways to store guns safely so that if your patients have questions, you have at least a very basic idea of how to guide them. And then lastly, I want to point you to the experts. I want to give you resources, even if it's as simple as a patient handout, a website you can direct someone to, something very simple so that you don't have to take on that burden of knowing all the knowledge all on your own. I'm going to start with a couple of statistics. So this is not going to be a surprise to anyone here. This is gun violence in our country is a public health epidemic. We have more than 100,000 people every year who are shot, and nearly 40,000 people die from gun violence every year. About 30% of Americans own guns, and that number might be a little bit different where we are practicing here in DC. But I think for most places where you might go after training, about a third of your patients are going to own firearms. So I think that it's important to be able to communicate the role of safe storage in preventing gun violence and being able to do that with your patients, no matter where you're practicing. I also want to note that a lot of what we're talking about is actually suicide. Most gun deaths are over half of gun deaths are a consequence of suicide, unfortunately. This number has only increased since the pandemic. This number is from 2020. I don't have data from 2022 yet, but I'm sure that it's much higher. And this number is just staggering to me, that the access to a gun increases the risk of death by 300%. And the mental health crisis post-pandemic, but even before, is really seen across every specialty. We're seeing this in the ED, in clinic, on the wards when someone's coming in with suicidal ideation, in the ICU if someone has actually attempted suicide, even in labor and delivery with prenatal and postpartum depression. So there's really a role for any specialty to kind of be thinking about, when I have a patient who I'm concerned about depression or suicidality, and am I screening them for guns in their home? Am I screening them on their access to guns and things like that? I mentioned earlier, this has been a pretty standard question that we ask on the pediatric side: are there guns in the home? And there's a reason for that. And there's a reason that pediatricians have been really leading the charge on this. And that's because firearms are the leading cause of death for children and adolescents in the United States. When I first read this, Brady was sending me stats back and forth. We were building this presentation, and I thought that they got this wrong. I thought that this was not accurate. I was like, oh, thank God they have me. I can do all the research and figure out what the actual leading cause of childhood mortality is in this country. And as of August 2022, according to a Kaiser Family Foundation study, this is actually true. So the thing that's killing children isn't the respiratory viruses, it's not pediatric cancers, it's not any of the things that I'm spending 4 years of my life here learning to treat and do something about. It's bullets. It's this. And I every time I look at this, I get goosebumps because it just is so sobering to me. It's really just the most tragic sentence that I think I could show you right now. I've got a few more stats for you. I'm not going to go through all of them. And I recognize that that you guys are, I'm a budding pediatrician and I'm talking to a room full of adult doctors, so I don't want to bore you too much. But I think that there are a couple of things that are worth noting. I think the main takeaway from this slide is that deaths in children are skyrocketing, whether it's homicide, suicide, school shootings. We know that guns that are killing children are coming from their home. And that's where you come in, because you're taking care of their parents, their grandparents, their neighbors, their teachers, their community leaders. And you're taking care of the adults who purchased the gun in the first place. We know that 75% of kids know where a gun is stored in their home. And about 30% of those kids have reported handling that firearm without their parent present. And unsurprisingly, there's a lot of disparity here as we see in other areas of medicine. Black youth have about a 40% increase in firearm fatalities in recent years. And I think maybe a naive reading of this is kind of chalk that up to, oh, well, that's community violence, that's gang violence, that's homicide. But I'll remind you that the majority of these deaths are suicide. And on average, US teens took their lives with a firearm every 7 hours. In the last year. So every 7 hours, a teen in our country is killing themselves with a firearm. And that disparity kind of includes our suicide rates as well. And if you look at this, I mean, it's really just staggering that our teens of color are so much more at risk of taking their own lives with a firearm than white teens. So I'm going to stop with the stats for a minute. I mentioned before that kind of the AAP, the American Academy of Pediatrics, is the one that's like really led the forefront in this for a long time. And I think one thing that I learned by starting to work on this work is that in 2015, it was actually ACP that convened about 8 different professional societies and published a call to action in the Annals of Internal Medicine. And essentially what that call to action was, with all of these organizations listed, was to say it is within our role as a physician to counsel on gun violence prevention, is within our role as a physician to talk about gun safety with our patients, and to not do so is detrimental to the health of the public and of our patients. I'm gonna take a quick sip of water because I'm starting to feel the cough coming. One second, y'all. One thing I want to talk about too is why the clinical setting is the right setting for us to be having these conversations. We know that repeat gun violence is very high. So someone who's been a victim of gun violence in the past is likely to be a victim again. Someone who's used a gun in the past is likely to use it again. We encounter these folks all the time. They come into the ED, they come into clinic, we see them in the wards, we see them in the ICU. And so the more that we're able to interact with them and talk with them and kind of build those relationships and start this conversation, the more impact that we can have. So our professional society says that we should be doing this and we're not doing it. So why aren't we? A lot of physicians believe that it's not within their role to counsel patients. They think that their counseling won't make a difference. They're concerned about lack of time, which I really feel that too, because I definitely feel pressed in my clinic visits or even on wards, talking to patients, you don't have a ton of time to get all of this in. And then another major concern is just feeling they don't have the training or the knowledge to be able to talk about safe storage with their patients. Sort of what I mentioned before, where if a patient says, well, actually, yes, doc, I do have a gun at home. I didn't really know what to say other than like, oh, you store it safely, right? I didn't know what that meant or like what safe storage looked like. However, I think it's interesting to note that most patients, including gun owners, expect us to have these conversations. They want us to have these conversations. They're comfortable having those conversations and they see it as our role to initiate that conversation. But I think the things on this side of the screen under the physician emblem, I mean, these are major barriers. Feeling short on time, feeling like you don't have the training, especially when you're talking to someone who might be a lifelong firearm owner who maybe feels very, very passionately about this subject. you might feel very ill-equipped to like go into that conversation. And that's a really tough spot to be in, which is where I'd like to come in and offer a couple of tips. So part of our curriculum, we developed a series of videos. There's 4 videos total. And they all take place in the primary care setting. I am hoping that eventually we can sort of expand this and develop more videos to show how patient interactions could occur in other settings besides clinic. But what this shows is a doctor and a patient having a discussion about guns in the home, and kind of you'll see his approach. Oops, go back. And I should say too, I know it might be difficult for the folks on the Zoom to hear, but we've added closed captions so you can at least follow along and read along as the video goes on.
Hi, Courtney.
Hey, how are
What's up?
Did you do the share with video?
I believe we did.
Yes.
I believe so, yes.
Okay.
I think so. All right, here we go.
you?
I'm good. Long time no see. How have you been?
I've been good.
Yeah.
No complaints. You know, the children are still keeping me busy and, you know, a little bit of lack of sleep from them, but, you know, it is what it is.
Kids.
Yeah.
What else is new? Anything new in terms of your own life?
I joined a pickleball team,
Okay.
so that's fun. So I do that on top of my, you know, the horses that I have and take care of them, and I still bike to work.
Okay.
So,
Wow.
yeah.
All right, I'm gonna have to educate myself on pickleball.
Yeah.
Um.
Should look into it.
Yeah. Well. Yeah. How about the bicycling? Are you wearing a helmet?
Yes. Always wear my helmet.
Okay. Same with the horseback riding?
Always wear my helmet for horseback riding.
Ah, I love it. Okay. What about other things in the house? How are we doing in terms of smoke detectors, carbon monoxide detectors, that kind of stuff?
Yeah, if I don't change the batteries in the smoke detector, which has the carbon monoxide attached to it, then they chirp, and it's really obnoxious and annoying, and my cats and dogs scatter, and it's a whole thing, so.
Okay.
Yeah.
This is great. So, you know, one of the things I thought maybe we could talk about today is some safety issues.
Mm-hmm.
The helmet is a great example, the smoke detectors, that's why I'm asking you this, especially with the kids around the house.
Sure.
What about guns? Any guns in the house?
Yeah, I have one gun. I keep it in my bedside table.
Okay.
So.
Do you keep it loaded?
Yep.
Okay.
Gotta have it ready.
I understand, especially because you live in the middle of nowhere.
Yeah,
I get
yeah.
that. You know, I guess the concern I have is the kids. And we know that if you have a loaded gun by your bedside, there is a much, much higher chance that the kids are going to get to that weapon, and then there'll be some sort of a family fire event. And by that I mean a episode or an event where the kids shoot themselves or shoot somebody else unintentionally. So that's what I'm worried about. You know, our studies show that it's much better if you keep the firearm stored and unloaded, and then keep the ammunition separately locked elsewhere. That gives you the greatest degree of safety from accidental or unintentional fire and family fire.
I think my concern about that would be if somebody breaks into the house, then how do I, you know, quickly get my gun put together with the ammunition? I do talk to my kids about gun safety, and like I could even put the gun on the kitchen counter and they would not touch it. They're really good kids. They know like that it's, you know, a weapon, and they know not to touch it, don't use it, it's for adults only.
Yeah, I've known you for a long time, and I'm sure that's exactly right. But, you know, you have to kind of go with the most common type scenario. In terms of getting to the firearm quickly, if someone breaks into your house, I totally understand that. That's another aspect of safety that we kind of need to talk about. You can use things like biometric safes to get to the gun very quickly. You can use things like trigger locks that still allow you access to the weapon, but then prevent the children from using it unintentionally. So there are ways around this that you can store the firearm safely. You know, it's the issue or the concern I have with keeping it loaded next to you and then making sure that kids don't touch it is kids are kids. And they can get into all sorts of stuff, and they'll do things when you're not even home, when you don't even know they're looking, when you're not looking, when they think you're not looking. And that's how family fire occurs, right? Is you have a child who does something they probably shouldn't do because they don't have the maturity, they don't have the understanding to handle the firearm safely. So I really would strongly encourage you to look into this concept and look into either trigger locks or biometric safes, keeping the gun safely stored. And I'm more than happy to give you some references you can look at and to see which one of them may work for you. But I think the way you're doing it now is just a little bit risky, especially for the kids.
Okay. That's fair. I would like those references if you can, and I'll look into all of those options. So
All right.
I appreciate that.
Talk about that next time you're here. Let's get back to you.
Okay.
All right, so I'm going to open up for a bit of discussion, and I know Dr. Welton's on monitoring the chat for other folks who want to chime in. What did you think about this discussion? What are your first thoughts? Is this a conversation that you think you could have with a patient? Do you see yourself having this conversation? Yeah.
I didn't know all the other things that you mentioned so I think I would have it because I don't know enough information to give advice about that. But I'm really glad that those advices like this recommendation a little more probably than I think we keep having
So just to summarize for the folks on the Zoom, Sarah said that one thing that was really great is that he seems to have a lot of knowledge about trigger locks and biometric safes, but she felt like maybe his recommendations could have been a little bit more strong and not have been so kind of, okay, well, let's move on to the next subject. I'm going to go over trigger locks, biometric safes, all of that stuff, and point you to websites where if you forget all of this as soon as you leave here, you can at least maybe try to Google that quickly while you're in a visit with the patient to remember. What about some other things that we thought he did well or things that you would have done differently? Yeah.
I think, and forgive me, I can't remember the citation, but the data says if you have a handgun in your home and the home is broken into, the intruder's more likely to use it against you. Mm. And the data says it actually doesn't protect, especially the person who doesn't. I don't know where the data came from, but gently it suggests that she's not safe with an unlocked gun at her bedside.
So Dr. Mitchell's thought is to sort of present data and sort of show that you're not safer with a gun near your bedside table. An intruder is more likely to use that against you than you are against the intruder. And I think to some extent data works great. But I worry about a mom who might counter and be like, well, my kids, you haven't met them. They're great. They're the best. They listen to me all the time. So I think leading with data is a great option, and then sort of tying it back to, I like what he did where he really framed it around safety. And he even mentioned like, okay, you feel unsafe, you're worried about an intruder, we should talk about that too. How can we help you feel safe in your home? And he tied it in with wearing a helmet, checking your smoke detector. Other things you can tie this in with are intimate partner violence screening, making sure you feel safe at home. Making sure that you are getting checked for STDs, making sure you're wearing your seatbelt, kind of all of those other screening things that we do. Are there any barriers that you are worried about, that you would have trouble having this conversation? I think Sarah kind of mentioned the lack of knowledge part. Is there anything else that struck anyone about what might be difficult for you to have this conversation? Yeah, Grace.
This person willing to know this patient for years and years. What if you're meeting somebody for their first visit? You might not have that relationship with them, and it could come off as antagonistic.
Absolutely. So Grace's point is that this provider clearly has a relationship with the patient and is able to kind of already has an established rapport that, especially for an intern or a resident who maybe hasn't built that relationship yet, can be really difficult. What about the phrase family fire? Had anyone heard that phrase before? I hadn't either before I started doing this work. Dr. Malatak told me that she heard there's a commercial going around now where they talk a little bit more about this. But I kind of like that framing too. It makes a lot of sense. I think most people, when you say it, they understand what you mean without having to explain it, although he did. But one thing I like about it is that it kind of gives things a name. So sort of to the earlier point about presenting data, it's like, hey, we have a name for what might happen in your home. It's called family fire. It's so common that we've named it. And that's why I want to talk to you about it. I think it sort of normalizes things a little bit. Okay, I'm going to move on to the next video. This one is a patient who maybe isn't as receptive as the first patient that we saw.
Hey, Mr. Cook, how are you?
Hey Doc, how you doing?
Good, good. I haven't seen you in a bit of time. How you been?
Good, good. It's been a while though, you know.
Yeah.
Yeah.
Well, it's good to see you back.
Yeah.
Anything new?
Nope, still got the old asthma going on, but apart from that, I'm doing good, I think.
All right. No major changes in your overall health?
Nope.
No concerns about your medications, nothing like that?
Nope.
All right.
None at all.
All right, all right. You look good.
Hey man, you know. Thank you.
Listen, before I get you up on the table and start examining you and stuff, can we just chat for a sec?
Yeah, yeah.
Anything new in terms of smoking, drinking, anything in that regard? Okay. So along the same lines, but I thought we could just talk about real briefly, in terms of safety and all, is also guns. Any guns in the house?
I mean, yeah, I got a firearm, but what if I do? I mean, it's my right as an American, right, to be able to protect myself.
100% is your right as an American. I got no problems with that whatsoever. How are you storing it, though?
I mean, look, Doc. I've had guns since Moby Dick was a minnow, all right? And I know how to take care of them in my own home, okay? Like,
No debate. No debate. I'm just asking because, as you know, keeping a gun that's loaded and not in a safe increases actually the chances of family fire. Family fire is when someone other than you, perhaps, can get to the gun and unintentionally shoots themselves, or heck, maybe even shoots you. So it's important to just, having the gun is fine, but it's important to keep it secured. And the best way to keep it secured is to keep it unloaded, locked, with the ammunition separately locked elsewhere. What do you think of that?
look, I've been doing the same thing for a long time, and ain't nobody been shot yet, all right? And look, I really don't appreciate you bringing political stuff into my visit.
Okay, no, listen, I hear you. I'm not bringing up political anything, honestly. I really am not. As I said, I kind of think about guns these days the same way that I think about smoking, think about drinking, alcohol, seatbelts, you know, the whole thing that kind of keeps us all safe and alive. That's, at the end of the day, what I want is for you to go 50 more years and keep coming here and giving me a hard time, because that makes me happy, okay? So how about if I do this? How about if, after we're done today, on your way out, I give you some literature. Just do me a favor, just look at it, on how to safely store your gun. We can talk about trigger locks, we can talk about biometric safes, we can talk about all sorts of stuff. Just look at it. And, you know, if you're interested, let me know. If you're not interested, maybe we won't talk about it next go around. Is that okay?
All right.
All right, so how about that one? Has anyone had a conversation with a patient like that before? Devin's nodding his head yes. Do you want to share?
Yeah, it was kind of when I was doing my school in Colorado, we had a lot of patients, particularly very hesitant against the idea of keeping their guns locked up, against the idea of things like trigger locks, partly for safety. That was a lot of things. And then, you know, there was one or two times where I would bring up the subject and got accused of making it political. In a very purple state like Colorado, I think people were very touchy about the subject.
Yeah, so the main comment that Devin made is that he's also been accused of bringing up political things in a clinic visit, and like that word gets used a lot. And depending on where you're practicing in the country, that could be seen as a political statement. So I'm going to go over in a few minutes a couple of opening phrases and ways to try to think of how to present it as non-judgmental or non-political as possible. One thing I loved about what he did was what the physician in the video did was he said, nope, it's not political at all. I asked you about your drinking. I asked you about smoking. I asked you about your seatbelts, and now I'm going to ask you about this. This is part of safety. So really framing everything around safety is a great technique. I've had a similar experience actually to this video. When I started doing this work, I had a Medicare wellness visit, and I was like, okay, this is it. I'm going to ask about guns in the home. I'm going to do it. It's an adult. Like, this is going to be fantastic. I'm going to nail this. And it was an older gentleman. I asked about who do you live with at home? He lives with his wife and his daughter, and her young daughter are moving in with them now too. I asked about smoking, drinking, then I asked about firearms, and he got very defensive very quickly. I think he probably said, why are you making this political? And I was like, oh no, I have really messed this up. But I was able to sort of use what I learned from the beginning of the interview. I mentioned his granddaughter and said, you just told me that a young child is moving into your home. I want to make sure that she's kept safe too. Is it possible for us to just have a conversation about gun safety? And he was like, well, of course, like he is a very responsible gun owner. He feels very strongly about firearm safety. And he was very happy to have that conversation. as the conversation went on, he also said, you know, now that I think about it, my wife is opening up a daycare out of our home, and it probably is a good idea for me to lock everything away in a safe. I was like, yeah, I agree. I love that insight. I also think that that's a great idea. And I'm not going to get into like whatever legal thing is going on where there's guns in the home of a daycare, but I feel like that was a conversation that like I easily could have just backed away from and been like, you know what, I'm so sorry. You're right. Let's just move on. We'll talk about your diabetes instead. But to kind of stick with it, sort of like what this physician did, and it sounds like what Devin's done in the past, and what I did with this gentleman, it kind of helps you get to a larger problem at play that you may not have even realized was under the surface. Anything else? Any other comments about this video? Things that you thought he did well, things that didn't go so well? Okay, we'll keep moving. I've got 2 more videos. For my morning report, I actually didn't show these 2, although it looks like this one's not showing up. Here we go. I didn't show these 2 because they are more pediatric based. This first one, I chose to show them today because I do have a little bit more time. And really the way that these conversations and the way that this video is filmed is it's a conversation between the doctor and the parent. It's a doctor and adult. So I imagine that there might be some helpful tidbits from this video as well. And another sort of attempt to sort of frame things around your family and the safety of your kids.
Hi, it's good to see Allie is doing great and right on track for his height and weight. How is he eating these days? Lots of fruits and vegetables?
Yeah, Allie loves all kinds of fruit, but we're still working on the vegetables. He does like sweet potatoes though.
Oh, great. Sweet potatoes are great. Try to include some leafy green vegetables if you can. And with the fruit, try to cover a range as well. Does he get plenty of time to play outside? What does he like to do?
Yeah, he loves playing at the playground with his friends. COVID had made it tough, but now all the kids are outside playing again, so that's been wonderful. He's also taking a soccer class too. All of his friends are in it.
Oh, that's great. And how about getting a soccer class and getting around in the car? How about his car seat? What kind of car seat is he in now?
Yeah, we were going to move him up to a booster, but he's still in his forward-facing seat.
No rush. He can stay in his forward-facing seat until he's 8. It's really the safest way to protect him in case of an accident.
Wow.
And what about inside the house? Are there any medications that he can get to? Any cleaning products? Are those locked up and out of his reach?
Yeah, they're mostly locked up or pretty high up, but I'll still double check and make sure everything is safely secured. So thanks for the reminder.
Great. And how about any guns? Do you have any guns in the home? Anything that he can access?
Yeah, no, absolutely not. No.
Mm-hmm. Okay, great. And how about any guns were in places he may visit or people he may visit, like babysitters, relatives, family members? Do any of those places have guns that he might get access to?
You know, my dad does have some rifles at his house. He uses them for hunting, but he primarily keeps them in the garage. So, you know, we spend some time there over the holidays. Sometimes Allie's there overnight, but why does that matter?
Yeah, great question. It matters because young children like Allie, if they get access to a gun, they may hurt themselves with that gun. And I'm sure you and your dad want to make sure that that doesn't happen. So we want to make sure that wherever he is and there's a gun, that gun is safely stored. And what that means is storing the gun locked, unloaded, with the ammunition in a separate place.
Yeah, no,
is that something you think you can talk about with your dad the next time you visit?
You know, yeah, I mean, I don't know what he's going to say about it, but I think, you know, it's a safety concern and we really should have a conversation about it. Do you have any materials you can provide?
Yeah, sure. I'm happy to provide you with a brochure for you and your dad.
Okay, thank you so much. I'll take a look at it.
Great.
Right.
Okay, any comments about that one? I know we're kind of seeing the same thing multiple times, so it's okay. But any thoughts from that video? One thing I kind of like that's been a thread through all the videos is sort of this idea of, well, at the next visit, why don't we talk about it? So for now, why don't you just have a conversation with your dad and we can check in and sort of see how you're feeling next time. I'll give you some materials and we can check in. I know this is in the context of a clinic visit, but really even in the hospital, we always have the next day. For those of you who are in subspecialties, you have the benefit of seeing your patient in the hospital as well as in clinic. So you can sort of continue a conversation that may have been started inpatient on an outpatient basis. And so I think that there's some opportunities for us to not try to solve everything all at one time. And this kind of speaks to Grace's point earlier about building a relationship with the patient. You might have a little bit more success if you kind of just throw it in a little bit every time and not try to be too aggressive. I do have one more video. I'm going to skip this one. This one, just so you know, is a video between a teen patient and a primary care physician. It's pretty similar to what we've seen already. But I'd like to get ahead and talk a little bit about sort of more of like the knowledge base on what you can tell your patients about safe storage. A couple of best practices. Number one, we want to remember that most gun owners are knowledgeable. Similar to the patient I had, he was very committed to gun safety. And when I presented it as a safety issue, he very much wanted to engage with me about that and talk about that. You want to make sure that your questions are free of judgment, not accusatory, and then keep your approach respectful. You want to meet patients where they are. As we've talked about before, this topic can be highly polarizing, depending on where you are in the country, and even in places where you wouldn't think it would be polarizing, it can be. So it's really crucial to avoid judgment and sort of focus on the safety and on the violence prevention. A couple of phrases that the Brady campaign likes us to consider using are things like, many families keep guns in the home. Do you have guns in your home? Are there any places where a child in your home could access guns? Or for folks who you're doing a suicide assessment on, if you said, you've told me that you've had plans of hurting yourself. There are many people who have guns in their home. Are you one of them? Do you have a gun at home that we should talk about? You want to avoid words like restrict or seize and talk about things about safekeeping, keep safe, let someone else keep. Again, really you can use the word safe as many times as you want. And I think that that's going to really kind of pull the conversation in a good place for everybody. A couple of things that we've talked about already. If a patient appears defensive, you want to talk about why you're bringing it up, discuss the goals of the conversation that you're trying to have. You can reframe the question too, and then also just ask the patients why they prefer not to answer. I think, once again, this is where there's always the next visit. There's always the next day. For most of us, this is not the last time we're going to see this patient, and we can always kind of continue these conversations as we move forward. That being said, unless there's risk, unless there's harm for the patient, they've said, I'm planning on using this firearm, or you're absolutely worried. It's always possible to kind of wait until the next time you see them, and then you can also provide them with handouts, which I'm going to show you a good resource for how you can do that. Okay, so we're going to talk about some of the practicalities of actual information you can give your patients. And again, I don't expect you to memorize all of this. I'm hoping you can take away a couple of key nuggets, and then I'm going to provide some resources at the end so that if you find yourself in this situation and you're like, oh, what did she say? There's trigger locks, there's cable locks, I don't know the difference. I know you'll know which websites to go to or how to get your resources together. So very, very basics. Hopefully everyone knows this. The easiest counsel you can do is say you want to store the weapon and the ammunition separately, and you want to lock it up. There's a lot of different options for keeping guns locked away, and I'll go over those and I'll show you some pictures in a minute. But those are sort of your basic safety rules. You want to encourage them not to store it under their mattress or like in a box in the closet overhead where someone might reach and grab it and it could fall down. And you don't want to store it in your valuables either. So these are some of the most common ways to safely store a firearm. The first one over here with this pink thing, this is a trigger lock. So this is a lock that goes over the trigger of the gun. And again, I am not an expert on any of this. I'm learning with all of you. So if you have any questions about this, I'm happy to do my best to answer. But I'm also sort of trying to figure out how I can talk to patients about all of these things. So with the trigger lock, it goes over the trigger, and there's usually like a keypad. This can also be biometric, but you can also have a locking key that goes over this. And the idea is that it's impossible to to actually pull the trigger with this lock still on it. In theory, this gun can be loaded while the trigger lock is on, which obviously is not ideal, but could be a potential sort of compromise maybe for a patient who's really resistant to keeping their ammunition and their weapons stored separately, even though that is the safest thing. You could say, well, okay, I understand. What if we put a trigger lock on that? Down here, we have a cable lock. This is a lock where it kind of threads through the chamber of the gun. And in order to fire it, you would need to, again, either put in a keypad, use an actual key to unturn it, or find use a biometric like a thumbprint for it to unlock. These, in theory, should not be able to be loaded while you have it in there, but I guess there's just very many different types of guns that are available, and so there are some where the gun could be loaded and the cable lock would still be in and in place. These are about $5 or $10. The trigger lock similarly priced, so a pretty inexpensive option if patients are worried about some of the financial constraints of keeping their gun safe. Over here, these are a little bit pricier. This might be for a patient who has multiple firearms at home or is collecting firearms. You can have a gun safe, which is this like very thick steel wall. It's heavy. You can store a lot in there. These can be a couple $100 or even up to $1,000. These are more likely to have the biometric locks on them, which is great. Using a thumbprint or something like that instead of just a regular lock and key that someone else could access, or using a code that someone else might know. And the gun cabinet's pretty similar. These are a little bit less expensive. The other thing that I would counsel patients on, for those who have kids and you're worried about their kids accessing their firearms, kids are a lot smarter than we think they are. They know the passcode to your phone, they know your birthday, they know their birthday, they know the home alarm system, they know all of it. And they will use it. So you want to make sure that your patients have a specific code for their gun safety that is unique to this situation. It's not something that they use for any other security system. Any questions about these? Okay. And now I want to direct you to a couple of resources. I'm going to go through each of these, not each of them, but a few of them more in depth. The first one is endfamilyfire.org. This is what their website looks like. This is a great resource for you guys. Hopefully that phrase family fire sticks with you, so that if you're in clinic or on the wards, you've got a patient that you're worried about and you're discharging them today, and you're like, gosh, I don't know. I don't really know what to tell them. That conversation didn't go that great. You can go to this website, maybe print out some information, stick it in their patient instructions, and send them home. So it's got these videos on it, but it also has some handouts, which I'm going to show you. And some other like state by state gun control laws. So this is sort of like what your options are if you live in Colorado, like where Devin came from, or for your patients who are in Maryland, or if you move away for fellowship or for your attending career in other states. You can look up and sort of see what you need to tell patients in the state where you're practicing. This is one of the handouts. It's not designed for you to be able to read it, but you can kind of see the gist. This is something very easy for you to print out in clinic and just fold it up and hand it to them. It goes over what the different types of locks are. You don't have to memorize all this information. You can just print it and hand it to them, have them read it, and you don't need to become an expert on any of this. A couple of other resources that I think are really exciting. Number one is Doctors for America. That's the group that Dr. Burke mentioned in the beginning that I've been a part of for a long time. They have a number of videos similar to this that are on YouTube, so a little bit easier to access. You can just sort of go on YouTube, Doctors for America, firearm safety, and look at a number of videos there. The AMA has a number of resources as well. And there's a great project called the Bullet Points Project, which is specifically for medical professionals who are trying to counsel their patients on firearm safety. And I've got one more brochure that you can print out. And this is more about explaining to your families or your patients what family fire is. So if you've got that patient who's never heard that phrase before, and is sort of maybe in a pre-contemplative state and is like, oh, well, I do want to keep my kids safe, and you're telling me that there's this new thing called family fire, you don't need to give them all the information all at once. You can hand them this brochure, let them think about it for a little bit, and then address it again at the next visit, and hopefully kind of move them forward on the behavior change spectrum.